Hello, everyone, and on behalf of the Training and Education Fund, I would like to welcome each and every one of you to this webinar. I'm Sandy Harris, the Program Specialist for TEF, and your navigational guide tonight. We will be discussing stress recognition and management. If you have pre-registered, you also received a stress test that was made available to you online through SurveyMonkey. If you haven't had a chance to do it, it's okay. You can do it after this presentation. It is just a tool for you to use to reflect on how you are coping with stress. Next. Thank you. Before we get started, we wanted to review some of the tools that you have on a Zoom webinar. First, all of the participants in the webinar are muted. So if you want to communicate with us, please use the chat feature. That is if you have a question, if you're having any technical difficulties, or you just simply want to say hi. If you have a question that has to do with the panelists, you can put it in the Q&A tool at any time throughout the presentation. And we will look at these. Some we will answer online, and some we will answer live during the webinar. Remember, these Q&As are all anonymous, so you don't have to be nervous about, that you're going to be linked with a question that you might want to give or ask. Also, please note that we are recording this webinar, and we will send out a link afterwards if you want to review or share it with others. If you are joining on your phone, your screen might look just slightly different. Look for the tools at the bottom of your screen. If you don't see the Q&A or the chat, if you click on the More with those three little dots over top, that should take you right to each one of those. Now for a little poll question. Okay, the first one, and we really encourage everybody to go ahead and vote. This question is this the first Zoom webinar that you have participated in? Yes, no, or not sure? I'll give you 5 seconds to answer. Okay, I hope you've all answered. And all right, so most of you have never been in a Zoom webinar before. So good, we're all forging new ground here. I hope you find it pretty easy to follow, and we will do our best to keep it as easy as possible. Again, I'm Sandy, your moderator. Our presenters today are Chris Berg, our Western Pennsylvania Nursing Skills Instructor, and Melania, our Program Specialist in Central Pennsylvania. Before we launch into the program, let's see just how stressed you are. These are the results from the stress test that all of you took, and about 50% of you are coping pretty well. About, excuse me, about 30% are pretty stressed, and about 20% are distressed. So hopefully by the end of this presentation, we can move a few more over into the coping. And again, again, if you didn't have a chance to do the stress test, you can do it at any time after this presentation. Now it is my great pleasure to introduce our presenter for this evening, Chris Berg. Many of you may know her and even attended classes that she has taught. Chris is one of our instructors for TEF. She is a highly skilled nurse with a great deal of knowledge. Chris, it's all yours.
Thank you, Sandy. So good evening, everyone, and welcome. I'd like to thank you for taking the time out of your day. Maybe some of you have worked today, or maybe you're going in tonight. So I would like to thank you for being here. We're going to be talking about stress management and stress reduction, as Sandy had mentioned. None of us are immune to the physical effects and mental effects of stress. So I'd like to take this opportunity to go ahead and talk about it. I also want to remind you, you may not realize it, but being here, taking the time out to sit through this webinar. You may not realize it, but you're taking the first step on the right path to your own individual health and wellness. One thing about stress, we all have it. It often goes dismissed. And the reason for that is really people don't recognize that that headache or that stomach ache or whatever other emotional type feelings they may have is really a symptom of stress. So it's important that we learn the signs and symptoms of stress so we can learn how to recognize it and manage it so we can promote our individual health and well-being. I would like to mention that as a nurse, I can empathize with all of you. I have worked long-term care and also acute care and in other different positions that encounter working on the front lines. So I can empathize with the demand that it takes on us. So the demand every day is very trying on our bodies, both mentally and physically. We administer care to very complex residents, and we also deal with the family dynamics that are involved with that as well. And that also can be very trying on us mentally and physically. But we continue to go to work. We show up every day ready to care for our patients because that is what they deserve, but we do so with having little resources. The coronavirus that we are faced with today, as we know, is a public health crisis that's really become an added barrier to the healthcare setting and to our work environment. Healthcare workers already have a challenging work environment, and now it's become even more difficult. Next. So what is stress? Just taking a look at that slide there. I want you to think about what it is for you as an individual, because again, we all experience it. So defining it a little bit, the word stress is a common umbrella term, which can involve a mixture of feelings, thoughts, and emotions. Stress is a body response to a physical, mental, or emotional burden that we may have. One thing about stress is it's very unique and it's very individual, it's very personal. A certain situation that may be very stressful for one person may not be stressful for another. Next. So taking a look at our slide here, just to give you a visual, we have a woman in a parking garage with can't really tell if it's a man or woman in the back, but an individual behind her and wearing dark clothing, has a hoodie on. Picture's kind of a little blurry there, but the whole point is for you to recognize, just looking at her and what we may think that, what we feel that she could possibly be thinking. She looks like she's on high alert. So this happens when stress puts a demand on us, when we start to feel that we're threatened or there's any type of demand, our stress is going to respond through body language. So when you sense danger, whether it's real or imagined, the body's defenses kick into that high gear, into that rapid process that we call fight or flight. I'm sure you're all familiar with just the wording fight or flight response. So that's what happens. And fight or flight response is a normal response. So I don't want you to think it's not normal. It is a normal response to an individual stressor that we may have. So this picture here really is just to give you an example or a little sample of what the physical indications may happen to our body when we experience that fight or flight. Usually you get the heart palpitations, tremoring, sweating, you get that really fearful, scared feeling. And we all do react differently to different stressors, but we do sense those body changes and they do affect us physically, mentally, and emotionally. So again, it's in different ways for different individuals. One thing I do want to mention that stress can be from our own environment, or your own body, and your own mind. So what is anxiety? So some people may think that stress and anxiety are one and the same, when in fact they are different. Certainly they're related, they've got a lot of common characteristics, but we're going to define anxiety now. So does it differ from stress, and what is it? So anxiety is a chronic emotional response to a stressor. A person may experience feelings of constant worry, just fearful thoughts, and sometimes they don't really even know why they're feeling this worry and fearful thoughts. It's characterized by feelings of tension, those worried thoughts, and physical responses. So taking a look at this picture, looking at this picture, if you had to put a name with it, think of how you would describe this type of a picture. I see a gentleman here and he just looks like he is in intellectual overload. Just brain is overstimulated here. This is what happens when we are encountered with stress, right? So when we're feeling acute stress, once the stressor is removed, the body's reaction to the stressor is also removed. I like to use the example, we have daily life stressors. For example, if you're going to work and you can't find your car keys, you're running all over the house, you start to get anxious, you're going to be late for work. Oh no, can't find my keys. You start picking up paper, couch cushions, whatever it may be. And you start to feel that nervousness. You're starting to breathe heavy. Once you find your keys, it's like, oh, everything's okay now. I found my keys. I'm going to make a quick call to work. And you tell them, I'll be in. I got my keys. I'll be in. That stressor goes away because now you found your keys. These are daily life stressors that we all encounter. So something I did want to mention there, but when we're talking about anxiety is going to persist even after that demand or the threat is gone. So stress and anxiety are common. They share common characteristics, but remember that stressor, once it's gone, those physical responses also go away. Anxiety can create phobias. We've all heard different phobias. We're going to talk about flying phobia or flight phobia that we call it. So an example of anxiety when it comes to stress is a person may have difficulty sleeping for weeks prior to flying. Before, they're going on vacation, they've scheduled a flight, however, they're afraid to fly. So they lay in bed at night, awake, can't sleep, they toss, they turn, out of anticipation of this flight that may happen 3-4 weeks from now. That's anxiety. It's present even when the stressor is not actually present. So the flight's not here, it hasn't happened. However, it's affecting the individual and their ability to sleep because they're worrying about it. So once the flight happens, the plane lands, the stress starts to diminish. The person goes about their vacation until the next time they've got to get back on that airplane, right? As soon as they start to anticipate getting back on that flight, that anxiety happens, the constant worry, the laying in bed at night. So that fear is there, that constant worry is there. This is what we call anxiety. Next. So we've defined stress and we defined anxiety. We're going to talk about the components of stress and anxiety, specifically tailored for healthcare workers. So as we move forward, we're going to talk about those different ones, and it's because healthcare workers are exposed to chronic stress. I used the example as a daily life stressor whenever we lose keys, right? But this is chronic stress. Healthcare workers go to work every day, and that chronic stress is there daily. So that can cause increased anxiety, increased stressors. We know these can lead to harmful effects on our body. So I do want to remind everybody, all personnel, that whether you're in the nursing, direct line of care, or your disciplinary staff, all disciplines of the healthcare setting are really affected. So this really applies to everybody in the healthcare team because every individual has a piece of the puzzle that makes up the whole healthcare team. Being aware of the stress is your first step towards managing your stress. So I would like to mention you're here today. This is the first step in promoting a better positivity for yourself, better able to manage your stress. Next. So we're going to talk about those 3 components I mentioned about stress and anxiety. And some of these terms may sound familiar to you, but we're really going to define them. And I'll give you some examples. The first component of stress and anxiety is compassion fatigue. Compassion fatigue is the physical and mental exhaustion experienced by a caregiver. Compassion fatigue is the reaction to the relationships, and I stress the word relationships, reaction to the relationships such as caring for someone who's suffering. So in simple terms, it's feeling the stress from others' trauma. You go to work, you take care of very sick patients, you may hear their stories, their traumatic experiences, losses. This is what we describe as secondary stress. Caregivers who experience compassion fatigue tend to stay engaged with the patient, always wanting to give more. Simply working in the environment where people are where people are suffering can cause chronic stress, can lead to compassion fatigue. Studies do suggest that people who are attracted to caregiving often enter the field already compassion fatigued. A personal experience with caregiving and or loss and suffering are possible reasons. So I'm going to give you a little example on that. So an example would be the daughter of a woman who has terminal cancer decides to leave her job working as a waitress. And she wants to become a nurse aide because she admired the staff who cared for her sick mom. She had the desire now of wanting to give back to others. It made her feel good that she could give to others after watching people care for her mom. That's an example of compassion fatigue, and when it says people enter the field already compassion fatigued. So another example of compassion fatigue, and it will give you a different perspective of it, is something that really is evident in today's field because of the crisis, would be healthcare workers who are witnessing patients suffering and or dying due to the coronavirus and not being able to have family at their bedside. I've heard this more than once, and I'm sure you guys have experienced it. Many disciplines in the healthcare team are experiencing this, what we call secondary stress from others' trauma. So that is compassion fatigue, and I gave you two different examples really from two ends of the spectrum. So we're going to move forward and talk about burnout. And again, it's a very common term you hear about, but what really is burnout? Burnout is, similar to compassion fatigue, but you will see the differences. So I had mentioned compassion fatigue. People really want to engage and stay with their patient. And those people have a reaction to the relationship. Burnout is a reaction to the environment. Okay, you're burnout. You've worked at a place for 10, 15 years. You work with the same coworkers. Maybe you possibly have some conflict with some of them. All those stressors that entail that work setting is causing people to be burnout. So it's a reaction to the working environment, whereas compassion fatigue is that reaction to the relationship. So caregiver burnout, reaction to that environment. It's not the reaction to another person suffering. So I'm going to give you an example on burnout. So if you're working with a coworker, as I mentioned, that you don't communicate well with, or you're working a lot of overtime, which some people may be due to the crisis right now, these types of things result in just caregiver burnout. You start to lose the desire to want to go to work. You start to anticipate who you're working with, what's the staffing going to be like, whatever the situation may be, the working conditions can be very exhausting. So it's a cumulative reaction that does happen over time. Caregivers who are burnt out, they tend to withdraw. So that is the complete opposite of compassion fatigue, where those people tend to stay engaged. What happens when the two of these, though, are like working together, they're at play together? So this can lead to what we call moral distress, the combination of those two leading to that. So when we think of moral distress, what does that mean? One thing I want you to think about is the word moral. If you think of your own personal morals, right? Morals, values, we all hold those very near and dear to us. So that's going to be our last topic, moral distress, that we're going to talk about, and I'd like to define it. Moral distress is the ethical concern that a caregiver experiences when they're faced with barriers to doing the right thing for the patient. For example, if you don't have the resources available to deliver quality care to your patients, you don't have enough briefs, or you don't have the right size of briefs for your residents, or you can't spend the time that you want to spend with them, maybe due to unforeseen staffing reasons or whatever it may be. Those frustrations and worries can cause moral distress. Today's crisis and the increased need for wearing personal protective equipment in the workplace, it's become a barrier for human touch. And it's, that barrier between the caregiver and the patient, that also can lead to moral distress. As we know, nursing home workers feel moral distress even without the crisis like COVID today, but the pandemic is really just putting more pressure on healthcare workers. Wearing the masks is creating a barrier between, the individual, the caregiver, and the patient. They can't show their compassion and really connect with the residents like they want to. Having a short supply of the personal protective equipment and maybe not the quality of, the greatest quality of the PPE that is supplied. And I do know that many, people in the healthcare field, coworkers, family members are dealing with people that or they've encountered people that are dealing with loss from coronavirus. So all these barriers together conflict our nursing core values and even our own personal individual moral integrity. Again, just simple right from wrong. Our primary commitment is to our patient. However, it is important to recognize and emphasize that we as healthcare workers must take care of ourselves, right? In order for you to be a good individual, a good caregiver, you must have the means of caring for yourself. That's what I would really like to stress. So going forward, stress impacts your life and your health. And I'm sure we could all give examples maybe at the end. We'll have some conversation in our Q&A and a little bit of time to chat about that. So when you think about it, stress and anxiety can have a huge impact on your life and your health. That's why it's important that you take control of your stress and learn ways to manage and control it. Sometimes people dismiss their stress, as I said earlier, and it's really because they don't recognize the signs or the symptoms. They think, oh, it's nothing, when really it's everything. I do want to mention that the stress test that you were given pre-webinar, I also use something very similar to that when I'm teaching in-person classes. And it's surprising to see how many people say, oh, I manage my stress great. And then they take that test and the answer tells them a whole different story. And again, it's simply because they did not recognize the signs of stress. Next. So stress taking a toll on your job and your health. Just taking a look here at patience and compassion, your income, affecting your body physically, rising your blood pressure. As we know, high blood pressure is known as the silent killer. So it definitely, I always say stress kills. Stress can kill a person. It sounds very blunt, but it is very matter of fact. So your response to stress can really have a huge impact on your life, your personal life, your career life. So when we think back to moral distress and or burnout, you may not have as much patience as you normally would have. So if you're a caregiver at work and you're experiencing this burnout, moral distress, you may be a little more short-tempered, having conflict at work, leading to work conflict that leads to, unfortunately, poor decision-making, possible disciplinary action. Sometimes you're hard on yourself because you feel like you're not delivering the care that you know that you can give and the care that the residents truly deserve. You might miss out on opportunities, again, and this could be related indirectly due to behavior, just from not recognizing your own stress and how you're behaving. So, that can interfere. So your body's response to stress can lead to also chronic health problems, as I mentioned a little bit. Headaches, neck aches, back aches, not being able to sleep, again, the high blood pressure, even weight gain. Stress can take a toll on us systemically. So some of these I may have touched on, but your family, your personal relationships, and then your mental health. So when you're in distress, your ability to handle those daily life stressors are diminished. So just reflecting back on when we lose keys before we're trying to go to work, somebody who's really not experienced a whole lot of stress may feel those acute stressors, right? And that body experience, then they find their keys and it's like, oh, found my keys, okay, I'm going into work. But the person who's experiencing chronic stress will be bothered and really kind of set off by the slightest little stressors that otherwise normally you could manage. So personal relationships in the home setting can be affected because mood changes may start to happen. We take our work home with us and we all hear we should leave work at work, leave that work at the door. But we are human, right? We go home, you don't, again, think of those signs and symptoms of stress, and you become very curt and very short with family members, maybe even withdrawal, stay in a room, you know, not want to socialize, things like that. So we become less involved. And again, people don't really pick up on their own symptoms that they're experiencing. So of course, you know, the impact of your mental health can cause you to develop behaviors also that could be harmful to yourself and or others. The stressed individual may start to engage in risky and or harmful activity, such as gambling. So, you know, these things get the person in trouble. You know, in trouble meaning monetarily, if they're gambling and they've gambled their whole paycheck away. And now we have another stressor because we can't pay bills, right? So high levels of stress can lead to irritability, self-doubt, insecurity. So not managing your stress can definitely throw you into a vicious cycle, something we want to prevent you from doing. So again, we want to be aware of our stress, aware of our impulsive mood changes, you know, lashing out at family members, not being able to sleep. These are the types of, you know, red alerts like, hey, your body's listening. I always say your body whispers. Make sure you listen to it. We're trying to prevent chronic health disease, and that's ultimately what stress leads to. Next. So what's the takeaway from everything we've talked about? 3 components. We've defined stress. We've defined anxiety. The takeaway is be aware and take care, as our PowerPoint up here shows us. Be aware and take care for the well-being of yourself and for others. It's important you find ways to manage your stress and how to control your stress. Remember, the first step to self-care is going to be through awareness, and that truly is the first step. You're here today, you're on that first step to self-care. You're becoming more aware. As a caregiver, it's important that you're putting on your oxygen mask first so you can properly administer care to others. Going back to the airplane. If you're in an airplane and you pass out and you can't breathe, how are you going to care for the person sitting next to you? So again, put that oxygen mask on first. Do for you first so you're able to do for others. So this applies to all disciplines of the healthcare team, not just direct care workers. Everyone should be taking care of themselves so they're willing and able to take care of others. So caring for thyself is not self-indulgent. Some people think that, you know, they shouldn't take the time for themselves. They kind of feel guilty about it. It's an act of survival. It's a necessity. You must take care of yourself. So this will allow individual health and wellness. Remember, if you want to be a good caregiver, you must learn to care for yourself first. Okay, so this picture, I don't know how well you can see it on what type of screen you're on, but just to keep in mind, we will be sending an email with all the slides on here. So I would encourage you in the future to definitely print this one out. I think it's a great tool to use for self-reflection. But we're going to take a look at it. So it's called the 8 Dimensions of Wellness. And while we're looking at this, I'd like for you to think of all these 8 sections or 8 dimensions. I want you to think of them as pieces of a pie. All of the pieces of a pie make up the whole pie, right? So I want you to think of your favorite pie. My favorite pie happens to be apple pie. So when I think of my life and where I fit into all these categories, I got to make sure I have good pieces of apple pie to make that whole pie, right? So when we're looking at this, I want you to think about where you fall in every section of this pie and all the pieces of it. So again, we'll send you the resources afterwards, and this is a good page I just think is worth printing for yourself. So let's talk about the first dimension of wellness, starting at the top, and I will go clockwise. So emotional. Coping effectively with life and creating satisfying relationships. It's healthy to have good relationships with whomever you have a relationship with. We want to make sure we're able to have that relationship, and in order to do that, we've got to learn to cope, and sometimes we do have conflict with relationships. Again, and communication is a whole other thing, but that entails coming into being able to have a good relationship, those open lines of communication. Financial. Being satisfied with your current and future financial situations. So, you know, I like to say, don't live out of your means, live within your means. And if you want to live larger, do what you need to do to get those finances there. That's just my little personal feeling on that. Social, developing a sense of connection, belonging, and having a well-developed support system is very, very important. We all want to feel a sense of belonging. We all should have somebody that we can go to when we just need a listening ear. Spirituality is the next one. Expanding our sense of purpose and meaning in life. Whatever your belief is, and everybody has a different belief, just having that belief there and, using that higher power whenever you feel you need to. So we all have to be secure with our own spirituality. Occupational, personal satisfaction and enrichment from one's work. Hopefully everyone has some self-gratification from the work that they provide. Certainly the caregiver who's caring for that resident takes pride in how well that resident is dressed, how well the room looks, etc. This is exactly what this means, personal satisfaction from your work. You've done good. The next one, physical. Recognizing the need for physical activity, diet, sleep, nutrition. So what do we need for our overall health, and what do the doctors seem to preach? Sleep, eat, exercise, eat well, get your sleep, and make sure you're keeping that body moving. Intellectual, recognizing creative abilities and finding ways to expand knowledge and skills. That's recognizing your own individuality and what you have to offer, and using your creative thinking in order to advance in some of your skills. And remember, we have room for advancing every day. No matter what the degree of education is, there's always room for growth and education. The next one is environmental. Good health by occupying pleasant, stimulating environments that support our well-being. So just think of the environment in which you encompass, and hopefully it's a healthy one. So those are your 8 pieces of that pie, and for me, 8 pieces of my apple pie that makes up that one whole pie. So when you think of these, and just kind of reflecting on what I just talked about, try and put yourself into each section of that pie and see where those pieces of pie fit for you. I know it can seem very overwhelming, but keep in mind this is a good way to self-reflect. And every now and then, I think everybody needs to do that. It also allows for positive perspective on where you feel you may fit in. Some people don't know where to start. Like I said, they're overwhelmed. When they think of, well, where do I start? Pull out this pie, start breaking it down into all the pieces, focus on the area of need that you feel you fit in to where you need it the most. So that's what I want you to do. Step back, take a look, picture that whole pie. Getting a big picture, sometimes we have to step back so we can, kind of paint that whole picture and look at that pie. But again, just focus on that area that you feel you need most. It definitely will protect you from chronic health disease and stress and anxiety, and that's our main thing, right? Stress and anxiety does lead to chronic health disease, and that's really what we're trying to prevent here. So focus on that whole pie. Next. So taking a look at this picture may seem like it's just a picture, but it's really a picture of different activities going on, and just really a sample or an example to give you some great ideas on where you can start for your own individual awareness steps and step on the right path to your own health and wellness. So awareness, as we said, was the first step. Acting on that first step is going to be your next step to your path of wellness. So do what works for you. And I do like to mention what works for one individual is, may not work for the next individual. So you may take some experimenting, a little bit of process of elimination. But one thing I think everybody has in common, and that is definitely we need a support system, whether it be friends, loved ones, significant other, find someone to talk to. Definitely important. I also think it's very important that you learn to care for yourself so you can become an advocate for yourself and for others. This really applies, to caregiving. Just, using the examples, how can you be a good caregiver if you're not caring for yourself? Same thing, how can you be a good advocate for others if you're not advocating for yourself? So it's a time to be resilient. Think of yourself and your health and your wellness and where you need to start. And it really is from within. Just some examples. Some people like to engage in meditation and yoga, engage in gardening, playing cards, just doing activities that you enjoy. And really all we ask of you is 5 minutes. 5 minutes, and you are worth 5 minutes out of your day. Some people again think, oh, I don't have time because I have this or that. 5 minutes, you can do it. 5 minutes because you are worth it. So many people find that refocusing on the positive is definitely very helpful. Kind of reflecting back to the wellness goal, focus on the positive, where you do have areas where you feel that you've really surpassed in. Some people like to write in a journal, things like that. Whatever it may be for you is what we ask for you to do. And again, that'll come from experience when you start doing whatever activities that you feel that you love to do. So take time for you. Take 5 minutes out of your day for you. Another thing I'd like to mention here is your employee assistance program. Some people are not aware about it, but it is a federal mandate that your employer offer through your human resource office, what we call the employee assistance program. So the employee assistance program is a free resource. It's free of charge. It's confidentiality, certainly. But they do offer things like counseling, help for abuse, any type of abuse, substance use, alcohol use. I even know a person that went to one of those before for anger management. So I'm not sure of all the resources that are out there, but certainly they do have resources. And if you feel that you're an individual that may benefit from that, or even if you know a coworker, I would refer you to the Human Resource Department for that, and you can get more information there. There's lots of resources out there, but the key is finding what really works for you. When we email you all the slides, you will have information about resources. So you'll get a resource guide with all those slides. Some are 2 offhand that I know of, the 8 dimensions of wellness, and then we have a little pocket card, eHelper. It's just something you can fold in your pocket, and when you're having that stressful moment at work, take 5 minutes to take a break, pull out your little pocket, take a look at it, and it's really just, okay, let me focus on me for a minute, 5 minutes. You'll get a link to the recording. And something also worthy of mentioning is if you have your healthcare benefits through SEIU, the new mental health benefit plan that's within those, your medical benefits, they do offer a 0 copay for mental health and wellness. And stress and anxiety is definitely something that some people can seek professional help for whether it's through counseling or what other modalities that, the professional would recommend. It's definitely not something to dismiss. There's no stigma in doing so. Take care of you. So we're going to move forward, but first I would like to mention, thank you for my part in being here. I'm going to refer back to Sandy, our moderator, and she will move us all forward in our next session of the webinar. And we'll have questions and answers at the end. Thank you. Sandy?
Thank you, Chris, and thank you for that very informative presentation. Excellent job.
Thank you.
And now we are going to do another poll. This question is just a yes or no answer. I'm hoping all of you will respond again. Do you currently use any techniques to relieve stress and anxiety? Yes or no? I'll give you a few seconds to answer, and then we will give you the results. And the results are, okay. About 2/3 of you, yes, do some techniques to relieve stress and anxiety. That's awesome. A few of you are not yet. Hopefully by the end of this presentation, we'll give you some great techniques and ideas that, that you'll come on over and join us. And with that being said, I want to switch gears just a little bit. As we have Mela, she's going to demonstrate some self-relaxation and massage techniques for you to try. Some of you may recognize her as Melania, excuse me, my tongue got tied up, is a program specialist for the Training and Education Fund. Take it away, Melania.
Thank you, Sandy. Hi, everybody. Thank you for being here tonight with us. We're really excited to have you here. And tonight I'm going to share with you a demonstration of some techniques that you can practice whenever you're feeling stress, anxiety, or as part of your self-care routine, which I see some of you already do, but hopefully the ones that haven't started, maybe this could be a good moment for you to start. So this demonstration that I'm going to make is part of a link that you're going to receive that has the full version of the exercises, but we want to give you a preview so you can join us tonight, and then you can keep practicing them at home. So we're going to start with a breathing exercise. And breathing or being aware of the way we breathe is really, really important, because the way we breathe is sending a message to our brain and to our body about how we are feeling and what is going on around us. So for example, if we're feeling nervous, if we are feeling stressed out, it is highly probable that our breathing is gonna become faster and it's gonna become more superficial. Right? So this will send a message to our brain, and it will be like, oh, okay, I need to be alert. I need to have this fight or flight response. Maybe my heartbeat's gonna raise. Maybe my muscles are gonna get tense, right? And on the other hand, if we're feeling relaxed, we are probably gonna have deeper breaths, slower breaths, and this will also send a message to our body that we can relax, that everything is fine. Right? That is why it is so important that we become aware of the way we're breathing, especially when we are feeling stressed. So we're gonna do a little exercise for this, and I'm gonna ask you to join me. Don't worry, nobody's looking at you, at least in the computer, so you can join me, placing one of your hands in your chest and the other one in your belly. Okay, and what we're gonna do is that we're gonna take a deep breath, and we're gonna try that our hand that is in our belly moves a little bit, right? The muscles expand as we bring the air towards our lungs, right? So this whole area tends to expand if we are taking a really deep breath. And the hand that is in our chest, it should not move basically at all. So let's try it together so you can notice these muscles when they expand, okay? So let's inhale. All right, did you feel it? That is what we call diaphragmatic breathing, and it is the best way to get oxygen to our lungs, okay? So let's try it again. Inhale. Very good. So let's keep this in mind for the next exercise that we're gonna do. It is a very simple breathing exercise. It is called 4-7-8. You're gonna receive a video about it, but it is called that way because we're gonna inhale for 4 seconds through our noses. We're gonna retain the air for 7 seconds, and we're gonna exhale through our mouths for 8 seconds. Okay, so I'm going to invite you to try it with me. You don't have to worry about counting. I will guide you through it. Also, if you feel a little uncomfortable or dizzy, you can stop and try again later, because sometimes when we become aware of our breathing, it turns a little bit hard, or maybe I can't hold my breath for 7 seconds, or anything like that. So feel free to stop and then try again later. But if you feel comfortable, let's do it together. You can place your hand in your belly if you want to be sure that you're having the deep breathing. Okay, so let's inhale for 4 seconds. Retain for 7 seconds. Exhale 8 seconds. All right, let's try again. Inhale 4 seconds. Retain 7 seconds. Exhale 8 seconds. Very good. Let's try it one last time. Inhale. Retain. Exhale. Very good. So this is an exercise that you can practice wherever you are, at work or at home or on the bus ride or whatever you want. Sorry. So it is really simple. It does not require any material. So I hope that you can practice it whenever you're feeling stressed or anxiety. And now I'm going to show you a couple of techniques to give yourself a massage in your neck and in your shoulders. This area is one of the ones that get more tension, right? Whenever we're experiencing stress. That is why sometimes we have instinctively, we like touch our necks or we're like, oh, right, when it hurts. But there are many techniques that you can use. So I'm going to show you some techniques for your neck and some techniques for your shoulders. If you have any medical condition, maybe you can ask your doctor or your physician first if you're able to do these exercises. But if you don't, then I invite you to do it with me right now. So we're going to start with the neck, and I'm going to ask you to use your knuckles and place them in this bone that is behind the ear, right? And what we're going to do is that we're going to glide our knuckles down to the base of the neck, slowly. You can use as much pressure as you like. I'm gonna do it 3 times. It should not hurt, it should feel good as you release a little bit the tension from those muscles. Don't forget to breathe as you do it. Let's do the other side. Again, the knuckles behind the ear and slowly slide down to the base of the neck. Very good. Should feel really good. Okay. Now we're gonna use our soft fingers here as well under this bone behind our ears. And what we're gonna do is that we're gonna slowly rotate our heads towards the other side, feeling there the base of the skull. Whenever we get to the spine, we stop. We're not gonna apply any pressure in our spine. Very good. Now we're gonna try this other side as well. As you can see, the hand is not moving. It is the head, actually the one that is moving. This is really good to bring oxygen to this part, to get the blood flowing, to release tension. Very good. And now we're gonna use our 4 fingers as well to start doing some gentle circles in the area. Try to see if we have any areas that might need more attention. Right? It should feel really good as these muscles release some of the tension. Now we can do the other side as well. Very good. You can even do both sides if you would like to. Okay. And now we are gonna start with the shoulders. What we're gonna do is that with our hands this way, in order to stretch these muscles, we're gonna press our shoulders and we're gonna bring our ear and our shoulder together. We're gonna press and then slowly we're gonna release and turn our head to the other side. All right, this should stretch our muscle. We're gonna do the same on the other side. Press, bring our ear and our shoulder together, and slowly release. Very good. Now we can try this same movement, apply to our muscle here, maybe 3 times. When you're doing it at home, you can do it as much as you want. Just applying some pressure like this in the muscle. All right. And now we're going to use our 4 fingers to as well do some gentle circles, some rubbing in this muscle. And it is a really big muscle, so you can try to reach as far back as you can. Trying as well to do the circles. If you find some knots, you can try to spend more time in that area. But the whole idea is to release the muscle there. Very good. It should feel really good. And let's do the other side as well with our 4 fingers. Don't forget to breathe. Very good. And now we're gonna work on our muscles here, the deltoids, a little bit, so we can squeeze them. We usually get some tension here, especially if we are lifting heavy stuff, or a child, or a patient, right? So we're gonna rub, and we can also move our shoulders back, front, up, or down as we do this gentle rubbing here. It will help a lot to release some tension. We can also get the other side. You can reach back as well if you want. Move the muscle, the shoulder here. Very good. There are many other exercises that you can do to massage these areas. So this was just a little demonstration. You can also shake a little bit to get this tension out. You should already feel a little bit lighter, a little bit less tension. And so I just want to thank you so much for being here with us tonight. And as you could see, these exercises might take 5 minutes or 10 minutes, as Chris was saying. And they can be very, very beneficial, especially for caregivers that experience so much tension during their day. So thank you so much for your attention. Sandy?
Thank you, Melania. And thank you for those wonderful ways that we can help ourselves to become a little less stressed and help relax our muscles just a little bit. And we have a few questions here tonight. The first question is, will you be sending out resources to relieve stress? Yes, actually we will. We have a list of resources that we will add along with the recorded video, so you will be able to have these resources. Next question. My residents are stressed. What can I do about it? How can I help them? Well, actually, that is a very good question. And I kind of have a twofold answer for you. I will tell you, in 2 weeks, we are going to be offering another webinar that focuses on talking with your residents about COVID-19. And then after that, we will be doing another webinar on doing activities with your residents, even though they are, you know, in quarantine. A lot of them are staying in their rooms, and it will give them something to do, hopefully, so they're not stressed too badly anyway. Any other questions? Definitely feel free to put in the Q&A or in the chat. And then the last one, excuse me, can any of you out there, do you have any stress relieving techniques or exercises or an app that you use? And if so, could you put them in comments in the chat mode? And Melania, did you have, you mentioned at one time about a something that you were able to access on, was it on YouTube or something that was free?
Yes, yes. Actually, there is a YouTube channel. It is called Yoga with Adriene, and it is a really, really good resource. It is free, and you can have all these different exercises that you can practice, for example, for stretching your back or for balance, for flexibility, etc. So it is really, really good. And there are many channels. Sometimes it can be like overwhelming when you Google, you know, for yoga or mindfulness, but I am aware that there are many apps that you can do or you can have for free, right? You can just Google that and it will send you to different sites where you can access these different techniques. We selected 3 or four, I think, links that you will receive after this webinar. And we hope you really like it. There's the breathing techniques, there's the techniques for the neck and the shoulders, and we also attached one that is a progressive relaxation technique that is also to work through your muscles. Also, I see Lisa here saying that Audible has free audiobooks that are good for putting you to sleep, if that is what you're having trouble with. So I think that can also help.
Thank you, Melania. And we have another poll that we would like to put out there. This one is, we would like you to choose maybe what you would like to see on the future webinars that the Training and Education Fund could present. There are several topics here. You can only choose one. And if you don't see the topic that you might like to see, then you could definitely put your idea in the chat box, and we will definitely put that on our list and look at what we can do to get these options to you. And some of the options are how to talk to residents about COVID-19, activities for residents during isolation, team building skills, communication skills, coping with residents who have dementia, self-awareness, and personality types. So I'll give you a few seconds to answer that, and then we'll take a look at what the results are. Okay, the results are, drum roll please. All right, a lot of people are looking for activities for the residents in isolation. That seems to be the winner. And then we have 3 other ones that are coming in a close second. And it's how to talk to your residents about COVID-19, team building skills, and communication skills. Thank you everyone who voted. I appreciate that. And remember, if you didn't see a topic that you really wanted to see, you can still put it in the chat, okay? We will be checking the chat even after we close out this presentation. Now, all of you have received some great information here this evening on techniques, how to handle stress. Please use some of these ideas. And remember, you are so important to your family, to the residents, and to the Training and Education Fund. We at TEF would like to express our appreciation for everything that you do every day. Thank you again for plugging into this webinar and into your own well-being. Again, our next webinar will be Tuesday, excuse me, I almost said January. I don't want to go that far, backwards or forwards. June 2nd, that webinar will be talking with your residents about COVID-19. And I hope to see you then. Thanks for attending. Please stay safe out there. Bye-bye.